Now, as we all know, the National Health Service is an incredible institution, but one that's coming under increasing pressure. More of us are living and are living longer, and some say that the NHS must adapt in order to survive. Care UK thinks it may have a solution. It's set up a number of mobile clinics that will be crossing Greater Manchester. Joining us now is Dr David Cade, a consultant from Care UK, and Kate Baxter, a GP liaison representative. Welcome to the show. So first of all, tell us a little bit more about these mobile clinics.
Well, we've been going for 6 months now, and we have three separate units. The larger ones are 5 mobile units, which are linked together, and they have 5 consulting suites, an area reception area, and a lot of diagnostic facilities, ultrasound scan, X-rays, CT scanners, MRI scanners. We have physiotherapy and podiatry on those units, and they move around 7 sites in Manchester. The other unit is an endoscopy unit for telescope examinations, and that moves around all 7 sites. We're based in Bolton, Rochdale, Oldham, Denton, Longsight,
so
Salford.
all across the region.
All
Let's get one thing straight,
yes.
though. These are NHS clinics, aren't they? They're fully funded by the National Health Service, so if people come looking for treatment, they're not going to have to pay.
That's right, yeah. Any patients who perhaps go to the GP and require a referral for either orthopaedics, ENT, urology, gynaecology, general surgery, those types of specialities, their GPs could be referring them onto this Care UK service, and that's to reduce the wait times at some of the local trusts. So they'll come in, see a consultant, and it works as like a one-stop shop, so they'll be getting any diagnostic imaging that they'll need on that day and then being referred on for a course of physio or whatever's required.
I mean, some might say, though, that already there are concerns that your GP surgery, as it once was, as it once was known, is already being eroded slightly, and this will sort of contribute to it. There will be the concerns about those implications.
I don't think so. I think this is exactly what the future will be, with extended general practitioner facilities. I think the idea is to get more patients away from the major hospitals who have a lot of huge problems to deal with, and to try and get patients managed closer to the home, in a comfortable environment, and rapidly. So we getting patients through in 22, 24 days is the principle behind it. Seeing the patient, where possible, a one-stop visit, and making the diagnosis, and in the vast majority of patients, arranging their management and sending them back to the general practitioner for longer-term management.
But arguably, it should be the case that every GP is capable of doing this anyway, that waiting lists shouldn't be that long, and that this level of service we should expect from the NHS.
Yes, but the people everybody who works in the units, all the doctors are consultants. So this isn't a consultant-led service, this is a consultant-provided service. So it's really what would normally be taking place in secondary care is taking place on these mobile units by senior doctors.
OK. There will be people, because it's unfamiliar territory for them, Kate, who will think, I don't want to do that. I'm used to seeing my doctor. Yeah. It's all new to me. I'm not interested. How can you make sure that everybody's included, especially because geographically it's quite difficult, isn't it, to make sure that everyone's included?
Yeah, I mean, the service has been set up to be more accessible for patients. So the 7 sites across Greater Manchester are within the communities in those areas, so it is easy to access us. We also provide a transport service, so for patients who don't drive or haven't got a support network who can bring them to their appointments, we can accommodate the transport for them, and that transport will be arranged whatever appointment time that they book, because sometimes there's some limitations around whether ambulance transport can be provided for hospital appointments if it's outside of standard working hours. But our clinics will be open 8 till 8, 7 days a week. So obviously transport will be provided for any of those appointment times. And in terms of accessibility, there is some patients who are used to receiving care within the hospital environment, but I think as that's starting to change, then patients are more familiar now getting care within health centres or within their GP practice, because facilities have improved and you can administer that treatment now within a primary care environment rather than needing to go to a hospital.
OK, well, as they say, the proof's in the pudding, so we'll be waiting to speak to some of your patients. Best of luck with it. Lovely to meet you both.
Thank you.
Thank you very much.